Welcome to another segment of HR the Leader podcast, where we build leaders, transform organization, and ignite purpose. We are in for a treat. I know, I say this on every episode, but every episode is pretty good. So we are in for a treat today, and I have the pleasure of having a conversation in the next few minutes with three amazing leaders. I've worked with some of them closely. Some of them mentored me indirectly, and I am honored that they said yes to this journey and come on this podcast. So I'm gonna let them introduce themselves, and then we'll get started. Not everybody jump out once. Who wants to go first?
Kristi,
Okay,
you're the
Carrie.
baby.
Oh, I knew you were going to do that. I am Carri McClure, and I'm currently serving in a leadership role. I've been in respiratory therapy since 2013, so not a terribly long time. But I have covered ICU, critical care, labor and delivery, neonatal intensive care, and recently finished my MBA at the University of Georgia. So I've I've done a lot since 2013, and I absolutely love this career. I can't imagine doing anything else.
Cool, Kristi.
Okay. So I am Kristi Burns. I'm currently in a leadership position here in Atlanta, Georgia, right in the heart of downtown Atlanta. And I love it here. Um, I have been a respiratory therapist for 16 years, I think it is. I just renewed my license, so I should know that. So 16 years. I've done pretty much everything as well except for transports. But I've also branched outside of critical care, adult critical care, and NICU. And I've done some business development within the LTAC arena. And then I've also been like a regional account executive for home infusion. So I've kind of just let my respiratory foundation take me far and beyond. So love the profession. As I always say, we have a lot that carries us. There's a lot we can do with it. So I'm just proud to be able to be one of the examples of that and to make other people feel the same and know that they can do the same as well. So that's kind of me in a nutshell.
Michelle.
And hi, I am Michelle Collins. So I have been a respiratory therapist for 22 years. I know, don't look it.
Really don't.
You don't. You don't.
I was a secretary before I became a respiratory therapist. At some point, I decided to go back to school. When I went back to school, I started learning about respiratory therapy, and that was where I wanted to be. I went to Georgia State and got my bachelor's degree there. And the advisor really suggested that I go to another school to get an associate's degree, but I knew, again, Georgia State is where I wanted to be for that bachelor's. I went back after many years to Capella University and completed my MHA. So, been in a leadership role since 2012. So, have certainly grown in that role. When I was at the bedside, it was all about patient care. And then got the opportunity to be in leadership and learn, there's a whole other world involved in this.
Yeah.
So there's so much that we can do from a leadership standpoint for our patients. So I am happy with what I do. I'm definitely an advocate for respiratory therapy.
Great. So we established it 22, 16, and 13. I think I've been in
Yep.
the field for around 13 to 15, somewhere around like that. I lost count. So we have established that we are expert in the matter to have this conversation. So first question, looking back at it, at respiratory, what is one thing at the bedside, because you guys still have your clinician hat, at the bedside back then, you think was a gem that we have lost today at the bedside? Because now we are all therapists. We all grew from the bedside and still having some clinical shifts into now a leader who actually brings in and seeing the evolution. What did we have back then as clinician that we think now is missing at the bedside, at a clinician level for respiratory?
The art of the basic assessment.
That's
That
basic. That's
that is
basic assessment. That
the gist of doing the basic assessment and understanding the physiology of what we do. I think we are missing that currently.
do you think we are missing that from nursing, not understand what we do, or respiratory RTs missing that?
I think both, quite honestly. I really do. I think that you know, I think the electronic medical record really changed things as far as how clinicians get and interpret information. I came into respiratory on the tail end of paper charting. So I was able to do a little bit of paper charting and just the differences in not inheriting a narrative with paper charting that you kind of get from the electronic medical record. I think that people are not thinking through what they're doing. I think that can apply to both nursing and respiratory, and I think there's a lot of fundamental gaps because of that. So I'm going to say the basic assessment is kind of missing.
Anybody else agree, or there's another point you guys are
No,
seeing
I
missing
agree.
at the bedside now?
I agree. And to add to that and to dive a little bit deeper, which is kind of what she said, but a little bit deeper is just concept, is the
Yeah.
why. Why am I doing what I'm doing? And when I do this, what difference is it going to make? Or
Yes.
when I do this, what should I expect the difference, to be, or what
100%.
should I see? So concept, like just the why behind why we're practicing and what we're doing to help patients.
Yeah, I absolutely agree with you both. Just understanding that what we do affects that patient either in a positive light or negatively.
Uh-huh.
Not waiting to get an order to do something because you don't know.
Yeah.
Like, I don't know what my next step is, but you should.
Yeah.
And if you don't, ask someone, get that help. Have someone who's a veteran or maybe that has some more experience than you. Okay, what's our next step?
Mm.
Because potentially what we're trying to do is get that patient off the ventilator. We're trying to get them back home to their family. And I think that sometimes we get so complacent. Oh, they've been on 100% all day.
Yeah.
And that's where I'm going to leave them because that's where I'm comfortable. So, just thinking about that. And quite frankly, I think in today's society, I see a lot of parents steering their kids towards healthcare because they're thinking they're guaranteed a job. But
Mhm.
if your teenager never took care of a dog, cat, toy, yeah, this isn't for them.
No.
Yeah. It's driven by passion. So
Yeah,
sometimes if that passion is
absolutely.
not there, it can take a left turn really quick. So
Yes, it can.
So this is gonna lead us to the next question, because I actually have questions, but you guys are actually leading me to these questions. 22, 16, 13, 14, 15. What exactly, or when did respiratory or this profession become more than a job to you? What experience did you have, or can you recall a point in time or a segment, a point in your career, or just one moment when you knew, okay, it flips from a job, a 9 to 5, not a 9 to 5, but 12-hour shift, into a career, into a calling, something more than that. Because as Michel said, if we're coming into healthcare to get a job. Back in the day, they told me, hey, in the healthcare, you're always gonna have a job. Back then, it was the prestige of healthcare. Now that we were in the leadership hat on the other side, we could see there's a lot of that was very untrue. So when in your journey of respiratory, it is switched from a job to something bigger than that.
I would say probably in about 6 months to a year. And the only reason
Of
why I
doing it?
say that is because what I always found myself doing was going over and beyond. in every situation. Like, I never just stopped at the assessment. I never just stopped at the ventilator changes. I never just stopped after I, assessed the ABG. Like, it just never ended for me, even after being there for 12 hours. Like to what Carri said earlier, coming in right at the end of paper charting, like, I wanted to make sure that everything was detailed, everything was outlined. Like, I always went over and beyond. And it was like, okay, Kristi, you really care, because
Yeah.
you don't have to do all of that, but you're making sure that more than just the job itself gets done. And I was putting myself in the shoes of those that I was taking care of, putting myself in the position of the family members that I sat and listened to at the bedside, just to, bypass time instead of going back to the department. I'm in room 12, speaking to the mama, or, talking to the child or something else. And so I was like, okay, this is a passion for me, because I take it a step further. It's never just here. It was always here.
Okay. I like that. For me, to be honest with you, it came with COVID. Believe it or not, I was in the field for a long time until COVID clicked. When it truly clicked for me for COVID, then I feel it was more of a calling than anything else. Was when I was helping. I'm from Haiti, so I'm Haitian. You guys already know that, but some of the people on the podcast may not. Um, I had 3 instances where I had a friend of mine. He couldn't get off the vent. He couldn't pass CPAP trial for 7 days, and we all know after 7 days what happened. It's a trach situation. And there was a language barrier. Anytime he would go into a sedation vacation, he started booking the vet, and they put him back, and they couldn't understand that. And during COVID, it was the iPad era, because we couldn't go into the hospital. So when the family was in the room, they literally called me during the CPAP trial and put it on the iPad. So I was communicating with him and Creole to let him know, hey, you got to get through this, because the next step of traching and rehab and everything else, the family didn't have great insurance. I was like, you do not want to go into that route. And he was able to get off the vent. And also too, during COVID, at the place I was working, I was holding the iPad for some people that I knew, and their family couldn't come and say goodbye. So I was holding the iPad for their loved one to be outside in the parking lot, saying goodbye while they were in there, because I was the person holding the iPad to some church family members and stuff like that. So COVID definitely sealed it for me. I was always a go-getter. I was always working hard, but it switched to a calling more than a job, more than even a career, because I think I was placed there at that time to help others that couldn't do it. Anybody else want to share on that pivotal point?
I think for me, the very first job that I had was at a big trauma center. And I always wanted to make sure that I laid eyes on every single patient I had, no matter how large my assignment was. And the computer program that they were using at the time had the way that you would check to make sure you had completed everything is there were exclamation points by the things that you didn't get done. And if I did not get every single one of those cleared out, it absolutely drove me insane. And I literally would chase people down, because the exclamation point wouldn't go away if the patient was transferred to another area. So I'd be calling the therapist, have you seen this patient? Have you done your assessment? And I would absolutely drive them nuts. And so I would end up going to do it myself, just doing the assessment so I could see the patient. And so I think that was so important to me. I just felt like the very patient I didn't see would be the one that really needed me. So I was obsessive about it.
Very good.
Think we all have to have a little bit of OCD
Yeah.
Yeah, for sure.
in this.
Yeah.
Mine, I think, goes back to H1N1.
Oh,
So there
yeah.
was a patient that I definitely remember really, really sick. And we got him back and home to his wife. And I remember us visiting him and his wife saying, honey, Like, these are the people that saved your life. He, of course, hadn't remembered any of it. So I think for me, I knew when I had that feeling that, wow, we took care of this patient and now he gets to come home. And we
Mm-hmm.
also had a patient that came back to visit us. And I knew that this is what I was supposed to do because of the feeling that I had. Because I was really, really happy about that. And just knowing how that made me feel, I said, yeah, this is what I'm supposed to be doing for
Mm-hmm.
sure.
So, how do you all feel with now that there has become a lot more of a transitioning career than a long-term journey? From 22, 16, we on the early teens. Now, if we actually keep a workforce for 3 to 5 years, your workforce is constantly changing. And respiratory is now seen as a transitional career than an actual journey. What do we think is attributing to that factor? And is there an ending sight for it, or what can we do as leaders in respiratory to help with that? It's still mind boggling.
That's kind of a loaded question.
Yeah, that was like 3 questions in one. I'm like, okay, what was number
Pick
1?
one. Yeah.
What
So
was
how?
next?
Because
This
I'm
is
just
when we
asking.
go viral.
Right,
So
yeah.
so because I was
What?
for real. So it's like it is it because I remember my first director position and my first resignation I received. I didn't sleep for 3 days.
Wow.
I was over it. I was hurt. I was
Mm.
sick. I couldn't eat. I was like, what did I do wrong?
Mm-hmm.
It was horrible for my first resignation. Say, hey, can I talk to you? So for a
Mm-hmm.
whole year, anytime somebody say, "Hey, Hans, can I talk to you?" My stomach turns. Now I'm okay with Hans, can I talk to you? But for a minute, anytime somebody say, "Hey, can I talk to you?" I'm gonna say, "Here we go again." So, so how do how do you all deal with that? That's one.
Mm-hmm.
And is there anything we could do to slow the exodus or the constant, we train them after 2 years, they leave. You've been here for over 20 years, 16, we're in the early teens. Are we gonna have that generation again? Are we training somebody's gonna stay for the next 20 years? Is that how we are seeing that as leaders?
Well, we have a tendency to eat our own.
Ouch.
We do.
Ouch.
I'm
Ouch,
just gonna
Carrie.
say it. We do.
Ouch.
We have a tendency to eat our own and not be as supportive as we could be.
Mm-hmm.
We got to do better. Just, we were all students once, and just allowing yourself to go back to that moment of uncertainty and just have some empathy for that student who is in that same place.
Mm-hmm.
I also don't know that we're as present at the bedside as we need to be. A lot of people are, not, there's a lot of complacency and not having a clinical presence. And I think that that's also impacting why this is not a long-term career for a lot of people. Like I said, it's a layered question. There's a several different layers there, but I think starting there, that's the first one. We're not really supporting the next generation like we should. And I don't know that we're investing in preceptors like we should.
Mm-hmm.
That's an important role.
It's super important, I feel like, as a leader, to not forget where you came from.
Yep.
If you aren't reaching back and helping the next generation or helping the next clinician within our profession, you are doing leadership wrong. Like,
Yep.
there's really no way around it. You're doing leadership wrong, and you are supposed to not only remember where you came from, but use the moments and the challenges and the barriers you had to overcome, like use those as teaching moments to reach back and help those other individuals get to kind of where you are. Or, maybe they have a different goal. Maybe they don't want to be in leadership, but still reaching back even from a knowledge perspective,
Yeah.
and helping them out is super, super important. And I know one thing, like I try my best now to like still round, because technically by title, I'm not considered clinical anymore. However, it doesn't take the knowledge from me. So when I round, I try to tell them, and I do tell them, I said, don't let these church clothes fool you. Just because I'm in scrubs, I'm not in scrubs, doesn't mean that I can't come in, do a vent check for you. Sometimes I see equipment laying around, but it's the small things that we can continue to do to help, or to at least be visibly present, like Carri said, um, in the everyday workflow and practices, of our teams or whoever it is that we are mentoring, sponsoring, and whatever else. But like, don't let the church clothes fool you. Like, I still can do it. I still can help you. And sometimes it takes just giving them like a little simple reminder. That reminder is also a verb. It's also a form of an action to let them know that I'm here. I support you. Because some people won't reach out. Some people are very vocal and others not so much. So I think it's just a matter of getting to know your people, knowing the generations, meeting people where they are, figuring out what works for some may not work for others, and then approaching it in that manner. And then I think that the times can change. But I do think, like Carri said, that has kind of been lost. I don't think it's with anyone on this call, but I do, or this podcast, I do think that it has been lost in leadership in general.
Yeah, I agree. Um, sometimes I kind of think we we lose that touch at some point, and you have to make sure that you're staying there and staying present and visible. That's one of the reasons why I don't move the location of my office, because I want to hear what's going on, to be in the want to understand what's over, what the pertinent things are happening with specific patients. I think it's important for our team to see that we're still there. There, hey, you're the director, but there's still the RT in you. That's the
Yeah.
thing. You're not just thinking about budgets and getting capital requests approved, but they're understanding that, oh, this person does understand what's going on clinically. They do understand what I need to do to fix this blood gas that's going down the drain, with your patient. Now, on the other hand, for your other two questions, I have learned to be flexible. I've
Yeah.
definitely learned to be flexible. I think, like you, Hans, I would feel so hurt when people would leave me, leaving me personally. But I also have learned to understand that I can't hold people hostage, because maybe they have gone as far as they can go with me. And maybe it's time for them to flourish with someone else or elsewhere. I'm like big on RT, being involved in other things. I think we can do case management. We can do other operational leadership roles. I don't see us as being one facet. And that's the message that I continue to say over and over and over to the staff. Some people I have to pull along kicking and screaming, and some are ready, like, okay, yes, let's go, let's do this. So I always correct people whenever they call us respiratory techs. I said, no, we're respiratory therapists. So I always make sure I do that, because I always say I've never used this as a back road to me not being able to get into nursing school. I was never interested in being a nurse. This was always it. So I think there's a difference there depending on what your wants were when you got into this profession. So I think it makes a difference. And you can tell the people that truly are passionate, like Kristi said before, or they're just here. Or like Carri said, we're just eating our own, So it makes a big difference.
Sure does. Hope you're enjoying the conversation so far. At HR The Leader, our mission is simple: building leaders, transforming organizations, igniting purpose. If you'd like to explore more leadership insights and resources, visit www.hrtheleader.com. And if this conversation is bringing value to you, take a moment to like the video, leave a comment, and subscribe to the channel. Your support helps this platform continue to grow. Now, let's get back to the conversation.
So this is a good segue to leadership. All of you guys are leaders, so we're gonna have that conversation. Tell me one aspect in leadership that is still tugging at you a little bit because you are so strongly invested at the bedside. Is there anything, any decision in the leadership realm that we do to take care of the business aspect of our organizations and what we do? And at times, it may not be the best for the staff at that moment.
Oh, I call it my personal golden rule of leadership is to not ask anything of my staff that I would not be willing to do myself.
Mm-hmm.
And, when you're put in a place where you have to possibly do that, it's hard. It's very hard. I've lost sleep over that several times. But like you were saying, I think you were saying earlier, Michelle, there's a whole world there operationally that you don't understand as a clinician that you do understand as a leader. And so that's the tough one for me. It's staffing decisions.
I think that's a tough one for everybody. It is tough. It is tough bringing in travelers. It's a tough decision to make
Very.
at times, and you still need to meet productivity.
Yes.
It's a tough one. Maybe I should have prepped you not to open that box, Carrie. I think we need to have a pre-meeting before the next
You
podcast.
asked,
Yeah,
okay?
I did. Yeah. So
Yeah.
anybody else? What is another tough leadership decision or leadership spot you find yourself in because you are a strong attached clinician at the bedside, where the clinician side wants to do something else and the leadership side is kind of having a conversation?
I don't know if this ties into what you're saying, but I think it kind of does. One of the things that I struggle with is empathy versus accountability. Because
Mhm.
you want to be empathetic
That
to
is a
the
good
fact
one.
of what's happening and what's going on, whether it's clinical, whether it's related to an admin, number that needs to be met, but accountability needs to be done as well. So it's like it puts you at a rock and a hard place because
That's what
so it's like, what do you do? And what I've kind of been telling myself in my most recent years of leadership is to stick to the facts. The facts don't lie. So
Nope.
when you stick to the facts, that creates the boundary and the shell that you need to be able to break the ice between empathy and accountability because the facts are the facts. And so it may be a little bit tougher or challenging to have that conversation when you have to introduce the facts, but it makes it a little bit easier because you have more I guess legs to stand on. And another thing that I wanted to say as well, kind of referencing what Carrie was stating, was there have been times where I've been super transparent about having to meet an admin need, even knowing that they wouldn't understand it, but trying to provide the why behind it and give an
Yes.
understanding. And because they don't understand it, it has come back to bite me in the foot. So I don't know, I kind of had to learn like, okay, is this a moment where I need to be transparent about it? Or do I explain the why in a different way? Like it puts you in a rock and a hard place as well. And then too, I'm pretty sure all of us have been in situations where you've done something with good intent and it's been twisted and turned
For
and
sure.
to something that is not what you intended. It was like, I was just trying to let you know, like, the reason behind the decision that had to be made. So now I'm a little bit hesitant to take that admin road down something that maybe they don't need to understand right now. And, try to explain it in another way to where it doesn't seem like I'm being a dictator either and saying, my way or the highway, but it creates a fine line between how things have to be explained. So I just wanted to throw that in there because it definitely will come back to bite you sometimes, even though
Yeah.
you have total good intentions with it.
Yeah.
Yeah,
Yeah,
I think we all
you're
can relate to that.
absolutely right with that, for sure.
Yes.
There are things that I used to share that I no longer share.
Yeah.
I said certain things just have to stay confidential. And,
Yeah.
yeah, I have supervisors. I'm going to tell them certain things but I'm not going to tell them everything. And I've had to, quite frankly, have that conversation,
Yeah,
you
of
know?
course.
And for me, I think I had to learn not to be a people pleaser, like Kristi
Mhm.
is saying, but actually come with those facts and say, this is what we have to do to improve our department.
Mhm.
Um, I think sometimes, the staff want you to agree with them and be supportive of them, which you should be. But we also have to take an honest look at ourselves and say, okay, this is the thing that we have to work on because
Yeah.
that's the way we improve. That's the way we get better. So I
Oh, yeah.
can't just lead you down a blind alley saying, oh, we're doing great when I
Mhm.
know there are things that we have to and
Mhm.
sometimes they know as well. Now if they don't realize that, that's when it becomes a problem
Yeah.
because then I have to step back and say, oh, is this person really getting what it is I'm trying to give them as far as the message? And if they're not, what other thing is missing? Like what have I done
Mhm.
before that doesn't allow them to receive this and understand why it has to be so.
Mhm.
Sometimes I think we're interpreters, like we're interpreting the money side, the
Mhm.
Yeah.
finance side, and then also trying to be supportive of the staff, So yeah, that's where we can absolutely get in between that rock and that hard place. And
Cool.
sometimes there's not a whole lot of space in there for us to breathe,
Mhm.
but we do the best that we can do.
Well, that's what makes it tricky is that, very few things that respiratory therapy does generates revenue. So,
Mhm.
our
Mm,
bread and butter is assessment. Our bread and butter is preventing readmission, preventing length of stay, delay,
correct.
encouraging throughput, preventing escalations. That's where we live. And that's very hard to justify from a revenue standpoint.
Yeah.
If you don't have it, you see it, but it's not an immediate lever that's pulled. So, it's outcome based. So that's hard, and it's
Yeah.
hard to make people understand that.
And having our team understand how to connect the dots and not just
Yes.
have tunnel vision. We're not
Yes.
just people that give breathing treatments. We're not just people that
Correct.
change parameters on ventilators. Like, have it all connect so that you understand how this one action affects, another
Yes.
system, not just the respiratory system. So
Right.
we've really got to get them thinking along those lines. Um, I think having a good educator and clinical specialist can help with that,
For
but
sure.
you really have to be a person that wants to receive that. And you have to be passionate about this profession. Because if
Yeah.
you're
Mhm.
not, it shows. It
It
Mhm.
definitely
does. It
shows.
It
does.
does.
All right.
Absolutely.
Let me move this right along. So, I'm sitting with great leaders, great women leaders, um, and I want to get leadership from a woman's perspective. What is one lesson you would like to teach me, a counterpart male leader, that I probably don't get about women in leadership? If you had to tell me, Hans, this is what I'm dealing with that you don't have to deal with, or this is what
Mm.
I would wish you would get. So again, we're not going to talk to all the male in general because I want my podcast not to be canceled. You're talking to Hans. So please, who Hans? As to Hans, I want you to do that. I want you to, the next time you deal with a counterpart who's a female and a woman in leadership, I want you to know that. If you all need to give me one advice how to better understand
Mhm.
women in leadership, it's your time. Please educate me.
Just one?
That's
Don't
all.
don't 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 do that. Don't do
I'm
that.
just
Don't.
saying, one? I
For
can give
now,
you
we
a
only have
run-on
How much
sentence.
time do we have?
no no
Right.
no.
I'll give you a run-on sentence of
Oh,
one.
so I'm okay. Give me your top two for now. So I could. Hans wants to be a better, well-rounded leader. So when he's working with his female counterparts or other leaders on my team who are women, I need to better understand where they're coming from, or when they say something, or better, um supply to their needs or better lead them. So just educate Han as to what he should know about women in leadership. Your top two, at least. Kristi, it's not that hard. Don't look at
What
me
you
like
got,
that.
Kristi?
Kristi was like, he's
I'm
not
just
ready for
saying.
this.
Okay, I'm gonna try to keep it at 2. I'm gonna make it a run on this. I'm gonna talk really, really fast so that you get it off in the time frame that you want it in. But I'm just being real. Like I've dealt with a lot, and we laugh about it, but to be honest, like it's not cool. Like it's not okay. And I think that it's super important, and it's so easy to be judged when you try to
I'm
speak
taking
on it.
notes.
I'm just saying it's so easy to be
Yeah, I'm
judged
taking
when you
notes.
try to speak on it because it's like, people try to categorize you and put you into all these different groups, and it's just really simple. So one thing is sometimes women, and I mean Carri, Michelle, y'all can agree, not agree. Sometimes women take things to a literal sense. So if you say something and you are my leader, or if you are a male colleague, however you would like to put it, or we're talking to Hans, so just forget all that. Hans, if you say something to me, majority of the time I'm going to take it literal. Okay. So be specific in what you would like, how you would like it, what the task is, what objectives, what's the goal, the mission, the vision, however you would like to title it, because we take it literal. Because of all of the other things that we have to deal with in completing, a task. I can speak for me personally, some of the things that I deal with, and I don't know if this is a male thing or if I'm really teaching you, or however you wanted to put
You're
it.
teaching me for this
Okay,
conversation.
yeah. So I don't know if I'm teaching you this, but I may be teaching you. One of the things that I deal with is the fact that I look young. I have literally been in rooms where I'm very observant, first off, because I've dealt with this so much, but I've been in rooms where I've purposefully been picked on last for my opinion and anything of that nature, simply because of how I look. And the
Mm.
reason why I know that that's what it is because by the time you get to me and I'm last and I state something, everybody in the room is like, like, oh my gosh, we didn't expect that, or we didn't know that, or, ooh, she's actually onto something. And it's quite annoying to deal with as a female, and just for the fact that I look young, because you're placing judgment on um my intellectual property that has nothing to do with how I look. So I don't know what you would get from that, Hans, but I feel like
I got
sometimes
it.
the male, if you are, depending on the positions and the roles that you carry, sometimes it may end up being something more so of protection. And I guess I can say this because there's been former roles where you and I have worked together. Um, but I think that it's super important that men and other individuals understand that perspective for people who are like me. That's all I got to say.
All right. So for you, let me get this. So for you, I'm taking notes. So you take it literal. So I need to tell you exactly all the information, all the details when I'm communicating.
Just tell
And
me to go. Let me do it how I want to do it. But
yeah,
be
but at least
yeah,
okay. And then the second one is you may look 16, but you're not 16.
definitely not 16.
Okay, cool. Thank you very much.
Yeah.
All right, I got it. Anybody else? I'm here to take lessons. Michelle, Carri, what I need to know about women in leadership. Your top two.
I mean, it's very easy as a woman to be made to feel like too much.
Mm-hmm.
And I'm, obviously a very outspoken person, very direct in how I feel. Of course, try to be professional at all times, but I will say what I mean and mean what I say.
Yes.
And it's very easy to be made to feel like being too much. And I'm fortunate in my current situation to have male leaders who welcome my thoughts and don't minimize my feelings or minimize my suggestions. They do take the things that I say seriously. So, I think that's the biggest one for me is, when a woman feels strongly about something, don't make her feel like too much. There's a reason that she feels strongly and find out why that is.
She's passionate. We're passionate.
Yes. Yes, for
Yes.
sure.
Kristi, we're done. That's Carrie's time. Carrie's
I'm agreeing with Carrie. I'm
Carrie's,
agreeing with Carrie. I'm
Carrie's
agreeing with Carrie.
passionate. For
You shouldn't have
you,
brought this topic up. You know how I feel
Listen,
about
for
this
you,
topic.
She's
I have
You
to make
shouldn't have
sure.
brought it up.
I'm with you. I'm with you.
I'm taking notes. So for you, I have to make sure I explain the whole thing and let you do what you need to do, and don't go by appearance. And Carrie is when you bring passion, don't make you feel like you too much.
Mm-hmm.
Yes.
I'm on point. All
Mm-hmm.
right,
Yes.
cool.
You're doing
Michelle,
good.
educate me about women in leadership so I don't find myself in these situations.
So, the first thing I have to say is when a man is in leadership, so male leaders are
Mhm.
seen as assertive, strong, organized. For a woman, we're bossy, we're emotional, and we're all over the place.
Yeah.
So I absolutely agree with both Carrie and Kristi. And so, Kristi, I'll start with you first. It's ironic that you say that because I literally just had a staff meeting with another leader and part of our team where I talked about that, making sure that we understand everyone brings something to the table. It doesn't matter if you're a veteran RT who brings all of the years of seeing actual cases with patients to the table, or it's a brand new grad who has great ideas and can help us see things in a new way. Everybody brings something to the table. And if you
Absolutely.
marry those two together, there is nothing that we cannot accomplish, but we've got to be willing to do that for sure.
Absolutely.
Then for you, Carrie, I would say at one point I did have like, anxiety about, oh my God, am I being too much with this? Am I doing that? Maybe I need to be this way. This person said this. Maybe I need to do that. I don't do that anymore. I don't do that. And in the last few years to really build on my confidence and be confident in who I am and what I have accomplished. Be confident in the fact that I'm willing to listen to additional ideas, but also be confident in the fact that sometimes my ideas are good too.
Yeah, yeah.
Hello.
you
Hello.
know? So
Mhm.
it's a lot for us to open up and it's a lot for us to take in. But I would like to see people have more respect for us for sure as women. We're not just emotional. Maybe we are a little bit more compassionate. Maybe we take additional things into the picture because we're mothers, well, I'm a grandmother. Y'all are grandmothers. But still always keeping what's best for the department at the forefront while I'm still trying to have empathy for the staff with what they have going on personally. Tough. It really can be tough
Yeah.
to be quite honest, Sometimes you can feel like, man, do I have to suit up and put my Wonder Woman armor today?
Yeah.
So it can be a little bit tough at times. But
Yeah.
I always say I signed up for the gig. That's what I always end it with. Sometimes I say, oh my God, up for the gig. So let's do it. And that's how I end that internal conversation in my brain. Like I
Yeah.
signed up for the gig,
Yeah.
so let's do it.
We're not dimming
Wow.
our light for nobody else.
Oh,
We don't dim our light.
absolutely not.
We don't dim it. We shine brighter.
Absolutely not.
Mhm.
Yeah.
Right. I think I have enough gem from women in leadership because in my current situation, 98% of my team build of women. So I respect that. My mom is a strong woman leader. She's still in Haiti and she's still doing wonders in her 60s. She's still pushing hard. So I
love it.
come from a strong women. My wife is a strong teacher. So I admire women in leadership and women leading. I don't have that problem at all. So definitely, there was a more educational for me and more refresher. So definitely, let me just review this for those listening in the back. So what these women told me, not for the other men, because I don't want nobody to cancel my show, but to Hans, I need to be very clear in the communication and do not micromanage because Kristi still want to do her thing, her own. But I need to be very clear. And just because she looks 16, she has a whole lot of experience, and do not downgrade her mental capacity. I've worked with Carri, so I know Carri's passion. I've seen Carri's passion at work. But just because when women shows passion, do not make you feel like you too much. Not even in looking funny. Don't dismiss it. Don't just say, there goes Carri again. And
Exactly.
so I need to be able to do that. And then Michel wrapped it all up and to say, do not dim your light. And you guys have more to bring to the table. And actually the passion that you guys bring is because you guys are nurturers, you guys are mothers, grandmothers, and you guys could bring a different outlook to the conversation. So I got it right? Good? I think so.
I like that.
Yeah,
There might be more, but we'll let you know.
No, I know there's
This
more.
is all you allowed us time for, okay?
we
Because
gotta
there's
come
plenty
back.
more.
Yeah, we
This
gotta
is all
come
we
back.
had time for.
Yeah, but hey, for now, let me go ahead and digest that for now.
Mhm.
So let's close out with some fun Q&A real quick. So if you have to take when you take your time off, do you take it for the summer or you take it for winter? You're a winter person or you're a summer person?
Summer?
Both.
Yeah,
Okay.
to both, really.
Well, I don't have
Yeah.
PTO ever. So
You say what?
I said I don't have PTO ever. So
Because you always on the go?
gone.
Okay.
Gone out of there.
All right. So wherever, so you more of a summer person. Coffee or tea?
Tea.
Come on, Kristi. Come on over to the tea
tea.
team.
Okay. ICU or floor care?
I see you.
I see you.
Okay.
I think there's a lot to learn everywhere. To both.
I think the floor is actually way harder because you don't have bells and whistles to tell you what's wrong. You have
Right.
to rely on your assessment skills. So I think the work on the floor is a lot harder.
You
Mm.
learn
And I
time
think
management for sure.
absolutely.
That's where I
All
spend
right.
a lot of time talking to those family members.
True.
Yeah.
Night owl or morning person?
Oh.
This should be quick and fun. Why we make this so hard?
But-
You're a night person or you're
Because
a daytime?
What
changed.
time?
What time we talking
Time in
about?
the morning.
How
I mean, I guess morning, but I
Mor-
loved night shift. My body hated it.
I
Yeah.
can agree with Carri on that. I worked night
Yeah.
shift for 13 years.
is this difficult because I'm not giving clear direction in these questions? Is this what's
Hey.
happening? I think so.
The
Because
first
I've
part
had
is realizing it.
quicker
Right.
response. Like this is getting difficult. All right.
Mine
That's
is
a hard question.
morning. Early
It's not hard
morning.
question. Like, okay. If you had to, because we got in this career for a long time, but if you had to choose something else outside of respiratory, what would it be?
A fruit stand. There has to be way less stress involved with that.
You say what?
On a fruit stand. That's my
fruit stand?
backup plan. Yeah, just have a fruit stand.
Wow.
Okay.
Completely different. Because to me, it would be like so much less stressful. It
A
would be
fruit
just
stand.
complete a fruit stand. That's my
Fruit
backup plan.
From managing a ventilator and leading hospitals to a fruit stand.
Completely different.
Okay.
During the pandemic, I said I was going to get a job at Whole Foods.
Okay. All right. Ladies, what else? What would you do after respiratory or if it was not respiratory?
They said I would be a MC, like, the life of the party, get the party started. Hey, MC of weddings, things of that nature. Or I will be a meteorologist. I'm super into the weather. Like all my friends reach out to me. They get upset when I don't tell them the weather in the morning. They find out it's
But
raining.
they have an app,
I am
though,
that
right?
person. Like I text people, it's gonna be raining. I'm just into it. I don't know, but I love the weather,
But
the
they
clouds.
have an app on the phone that says it's gonna rain.
Yeah. No, I would be a meteorologist. I'm just saying.
Would you have predicted the last snowstorm? Where you'll be out of a job, right? Remember the last
They didn't
snowstorm?
lose their job.
They didn't.
They didn't lose their job. So MC Kristi or
Or
meteorologist?
meteorologist. Yeah.
Okay. Michelle, how about you? If not
Uh,
respiratory, what else?
so one thing people don't really know about me, I was in a local singing group. We have went as far as going to New York to talk to a record company. That was way, 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 way years ago.
Mm-hmm.
And so I think I wanted to be a mother more to do that as I realized that lifestyle is not as glamorous as I thought.
Yeah.
But sing in just a local club, like not a nightclub kind of setting, but like a nice little lounge spot or something.
Ooh.
Or I
Okay.
could
All right.
just do balloons for parties. There's that too.
Yeah.
Okay. So the next time we hanging out, you bringing fruits. You're gonna be the life of the party, and Michelle and I is gonna be part of the band. Okay.
Yeah,
So
there
we
you go.
got
That works.
okay. So we
That
good.
works.
Works
Well,
for me.
ladies, it was a pleasure. So if you have to give one final advice to the upcoming generation of therapists or women in leadership, what would it be as a closeout? Was that direct enough, Kristi? Yeah. Okay.
I guess if you say so. I mean, I would just say stay true to who you are. Stay grounded in who you are because life's going to come at you in so many different ways, whether it's professionally or personally. And you have to know who you are as an individual. You have to know the morals and the values that you stand by, and you don't let any situation shake you. You stand firm in that.
I like that.
I
Carrie?
like that as well.
Would say be proud of what you do. We do such meaningful work at the bedside. We have the ability to impact organizations in the most positive way. So I would say be present, be proud, enjoy this job. It's a blessing to be of service to people. And we are able to do that. And it's amazing. So
Yeah.
that would be my message.
Thank you very
Yeah,
much.
I
Michelle,
like
take us
that
out.
as well. For me, learn to be comfortable with being uncomfortable.
Yes.
Because
Ooh, this
that's
is
how you
good.
Love
can
it.
grow.
Yeah.
That you can't grow just staying comfortable all the time. Knowing a job 100% and then you just stay there and that's it. What else do you have to offer to the world, and to yourself? So definitely learn to be comfortable with being uncomfortable.
Wow,
Yes.
this is good. This is good. Well, ladies, I said we're going to be here for 30 to 45 minutes. We are pushing an hour. So thank you very much for coming on this podcast. I enjoyed my time with you all. I've learned a lot. We talked about the journey of respiratory. I definitely have a few notes on women in leadership. So I'll make sure I'm going to study those so I could apply that. And definitely Carri likes to manage a fruit stand. Kristi wants to be an MC or possibly predict the next snowstorm. Michelle, you and I, we're going to actually put a band together, maybe like a little two-piece. And
That's
then
right.
set it up. And Kristi, and definitely I enjoyed this conversation, and I'm pretty sure our viewers and listeners will enjoy it too. Thank you for your time.